I get up and come to work every day because I love what I do at Truman.
I've always had a passion for caring and helping people.
Being able to take care of a patient, make them better, return them to sport or function, and have them return to normal life.
That's what we're here for. We're here for the patients.
Truman Medical Centers, at the core, is really two things. The academic medical center, we're very proud of that. We're also very proud of our roles as safety net hospitals.
Truman's focus has always been on serving the needs of the patient population regardless of their ability to pay.
Today, our total uncompensated care cost is $120 million per year. That's gone up 3 times in the last 15 years. And in order to keep our doors open, we've had to be as efficient as possible. And that means our IT resources have to be the best there is.
We're located both in the urban core of downtown Kansas City and also out in the community in eastern Jackson County.
We have 2 hospitals, about 600 beds. We have 51 clinics. We're aligned with the University of Missouri, Kansas City.
One of the other aspects that's really exciting with University Health, our ambulatory facility downtown, is we have a surgery center. It really provides a streamlined approach for our providers as well as our patients for day of surgery.
The partnership between UMKC and Truman is as old as the medical school itself.
Today we have 650 students and 400 residents.
There's also a pharmacy school here, a dental school on campus, and a nursing school.
Our students go on to major leadership positions around the country, everything from Surgeon General of the U.S. Air Force to CEO of the American Academy of Pediatrics. We educate the next generation of physicians.
Truman Medical Centers has been a partner with Cerner since the early 90s.
Through our partnership with Cerner, we've been able to achieve HIMSS Stage 7 on both the acute care and the ambulatory care side.
We've been able to embed tools into the EMR to help clinicians ensure that they are meeting the quality needs of the patient.
One of the key factors that Cerner brings that allows me to do my job faster and better is the ability to do everything that I need to do for a patient visit from one page.
If a patient is seen in the clinic yesterday and then comes to the emergency department today, there's no question of what happened because the information is immediately available to everybody in the EMR.
Patient doesn't have to tell their story 15 times. The information is there. They don't have to have a lab test performed 3 times because they go to 3 different providers.
Truman Medical Center has recently adopted new technology for our nursing staff, which is the Care Mobile device. It allows our nursing staff to have a device in hand at the bedside and scan the patient at the time of meds administration. An additional advantage of the Care Mobile technology is the camera capture feature that allows our nursing staff to photograph patient wounds, which automatically upload to the EMR.
Another benefit of working with Cerner is implementing the pharmacy uplift. We had many paper clinical processes and many reports, and we were able to optimize and utilize the Cerner system to automate those reports so that our pharmacists could intervene on potential patient improvement by utilizing this tool. We had an excellent experience working with the Cerner pharmacy team, and we were able to rapidly implement the program in a very short period of time. It could not have went any better.
We've also been able to achieve to date over $29.2 million worth of cost avoidance and savings.
Cerner's EHR really puts information at the fingertips for our students and residents, so they learn how to use that information to make real-time decisions, which of course is essential for safe and high-quality patient care.
The KC1 Health Innovation Alliance is the latest evolution in the partnership between Truman Medical Centers and Cerner.
The ability to have Cerner staff combined with our staff in one place working on this together, that's really the essence of what KC1 Health Alliance is all about.
It's not just about Truman Medical Centers, it's not just about IT, it's not about Cerner. It's about how Cerner and Truman Medical Centers are going to come together to take care of the Kansas City population.
We believe strongly that care doesn't begin and end at the 4 walls of the hospital. Once a patient comes into the hospital, I mean, we can do great things, but really that's not where health begins. Health begins out in the communities.
Currently, we're utilizing remote patient monitoring as a mechanism to put devices in the hands of our patients when they're at home. It gives us the ability for earlier intervention with patients. We don't have to wait 3 months to see what their hemoglobin A1C is. We're able to monitor those trends in near real time.
University Health on the go is in supermarkets, grocery stores where people do their shopping. We also are partnering with the YMCA, and we'll have a 7,000 square foot facility which will provide primary care medicine.
We also have a patient portal that many of our patients use, and they can see what's happened to them at the hospital, at their clinics. That's been extremely important in them partnering in their health care.
The rev cycle solution, I think, is very key for us to really function successfully in the future under these new payment models. We are now going to have the same vendor responsible for all clinical and financial applications. We can eliminate a lot of duplicative services.
What's really important to us is the relationship, the partnership, the fact that you have two organizations working together toward the same goal. That's why we're a Cerner client.
We feel confident that Cerner will be continuing to work with us to meet the needs of healthcare in general and help us remain the provider of choice in the Kansas City area.
The sky's the limit. They're a long-term partner for us. We're in the game, and we're looking forward to what the future holds.